I was pregnant 4 years ago when I had my son, and the number of people who would come up to me and tell me, chemicals mat lagao skin pe, put only baby oil on your tummy and only that, just that. And I was like, I am a dermatologist and I am telling you that baby oil is going to do nothing for my stretch marks. And it's okay to put pregnancy safe chemicals on your skin because they have been scientifically tested and proven to be safe during your pregnancy. And cut to so many years later, now when I see women in my OPD, pregnant women in my OPD, coming in with severe acne flares or a cloasma starting to happen, and their husbands or their families just tell them, "Kuch bhi mat lagao, your baby is more important. Do not put anything on your face." And these women are so depressed because acne flares in pregnancy can genuinely be that bad. These women should be enjoying their pregnancy and living it up, and they're sitting at home hiding their faces, too embarrassed to face the world, and they're depressed. And it just breaks my heart because there is pregnancy safe skincare out there. I'm Dr. Tanvi Vaidya. I'm a board certified dermatologist, and this is a cause very, very close to my heart. And this video is going to be all about pregnancy safe skincare, what you can do and what you cannot do. To start with, let me just tell you that this glow of pregnancy, I think it's a myth being fed to keep us happy during our pregnancy. I don't think this thing exists. You're flushed, your skin gets dry, or you get acne, you get pigmentation, you get stretch marks, your hair starts falling out once you deliver. There's a lot that can go wrong with your skin and hair during your pregnancy, also your nails. In saying that, it's a glorious time. I loved my pregnancy and I miss it so much. It's the only time in the last 4 years that I could sleep well. It's a great time, but your skin does suffer. So let's accept that, let's acknowledge it, and let's not live in denial. Coming to the first and the biggest concern that most people have with pregnancy is stretch marks. So, stretch marks literally happen when your skin stretches and then goes back to its regular state. It typically happens during puberty when there's a growth spurt. Boys and girls both develop stretch marks, typically around the shoulders, the hips. Girls may develop it on their breasts. Sometimes you get it on their knees, on your lower back. Lots of people have stretch marks, and I think they're pretty normal. And unless they majorly bother you, I don't think you should worry about it too much. That being said, can you prevent stretch marks? Bio oil, coconut oil, this oil and that oil, honestly, do not have any role in preventing stretch marks. There have been no studies to substantiate their use. If at all, anything can help prevent it or at least minimize the amount of stretch marks. Centella asiatica, which is Cica, massively helps. Hyaluronic acid helps. Basically, just keep your skin really well moisturized. Keep moisturizing again and again. So, if at all, they can minimize the amount of stretch marks that you end up with later. Once you're done with your pregnancy and you're done with your breastfeeding, you can also add in tretinoin. Tretinoin, honestly, is the one that has been proven to have a significant role on reducing stretch marks, but it is not safe during pregnancy and lactation. So, you unfortunately have to wait till after you're done with your breastfeeding to get started on using tretinoin on your stretch marks. You can also consider procedures at that point like PRP, microneedling, certain fractional non-ablative lasers can be used to work on your stretch marks. Again, they would reduce your stretch marks, they would reduce the prominence of your stretch marks by even a 50 to 75% reduction in your stretch marks. But are they going to get rid of them completely? Unfortunately, no. That being said, I myself am a dermatologist. I have stretch marks. So many of my friends who are dermatologists also have stretch marks. So if there was a technology to completely prevent it, we wouldn't have gotten it right. Um, I know so many actors, so many models who have stretch marks, and you don't see their stretch marks because everything's so photoshopped nowadays. And I really feel that this is something that needs to be normalized. And we need to talk about how your stretch marks are your war scars, and they need to be worn with pride. They tell a story of this whole human being that you created within your body. So don't fret about it too much, but if it does bother you, you can discuss with your dermatologist in terms of the treatments that you can undertake once your breastfeeding is done. Next, coming to pigmentation. Now, pigmentation is a huge concern during pregnancy. Typically, any pigment that you already have, like your lips may darken, your nipples may darken, you may develop a darkening of your underarms, of the groin area. You may develop something called chloasma. Chloasma is this pigmentation that you develop on your cheeks. It's called melasma otherwise, but when it develops during pregnancy, it's called chloasma. So these brown spots on your cheeks or on your nose or on your forehead or on your chin. All of that is melasma. All of these things can really develop because of the hormonal roller coaster that is happening during your pregnancy. Now, what do you do about it? One thing is start using sunscreens regularly. I know there's a lot of myths about sunscreens saying that, oh, they're not safe and they're toxic and they're cancerous. That is nonsense. But during pregnancy, use plain mineral based sunscreens or physical sunscreens, that is, zinc oxide or titanium dioxide based sunscreens, are proven to be safe during pregnancy. Chemical sunscreens have a theoretical risk of getting absorbed into your system, reaching your baby, or if you're breastfeeding, going through your milk and reaching your baby. So it's just a risk that we don't want to take. So stick to mineral based sunscreens, but definitely use sunscreens because all of this pigmentation is very, very linked. In terms of depigmenting ingredients, if you're developing pigmentation, you need to use something to fight it and to depigment. So what you can do is use pregnancy safe ingredients, avoid the unsafe ones, that is essentially hydroquinone and arbutin. These are not pregnancy safe. Amongst the rest of them, I'll just list them out for you. Vitamin C, niacinamide, kojic acid, licorice extracts, lactic acid, glycolic acid, all of these ingredients are pregnancy safe and they really help to depigment your skin beautifully. So you can start with using a vitamin C or a niacinamide in the morning, and you can use a kojic or a glycolic acid at night to help depigment your skin. Next comes acne. So as I mentioned before, acne is a huge concern during pregnancy. People break out like nobody's business. Essentially, this happens because of the hormonal shift that's happening in your body. Your skin becomes more prone to acne. The sebaceous glands, which are the main place of pathology of your acne, sebaceous glands become overactive during pregnancy. So, what you can do again to control it, I will list out the safe ingredients and the unsafe ingredients. The unsafe ingredients are retinoids in any form. So, whether it is your retinol anti-aging serums or whether it's adapalene, tretinoin, trifarotene, none of these are pregnancy or lactation safe. So, avoid those and avoid a salicylic acid 2% and above. Avoid using salicylic acid on very large body surfaces. Again, there's a risk of absorption, which could be toxic to your fetus. So that aside, let's come to what's safe during pregnancy to treat your acne. Use benzyl peroxide based face washes or gels or creams. You can use a salicylic acid face wash because the contact period isn't long enough for it to possibly get absorbed. You can use niacinamide, you can use azelaic acid, you can use glycolic acid, lactic acid. All of these ingredients are pregnancy safe. Of course, along with topical antibiotics, but a lot of these may be prescription ingredients. So do talk to your dermatologist. Do not use vitamin C. Though it's safe during pregnancy, it's not safe for your acne. It will cause further acne flares, so just avoid your vitamin C. Other than this, don't pick at your acne, don't touch it. Wear your sunscreen regularly when your acne is healing. Avoid eating too much of sugar and too much of dairy. I know in our typical Indian families, we're overfed like cows. We're fed and overfed and overfed. Your moms will come with laddus and mithai and this and that. But guys, go easy. You don't have to eat everything that is being served up to you. Eat well, eat nutritious, balanced meals, have a lot of protein in your diet, but go easy on the sugar and the dairy overload that is given to us during our pregnancies. If you have dandruff, treat your dandruff. Avoid oiling, avoid using facial oils, avoid oiling your hair too much, or just oil your hair about half an hour before you shower so that oil doesn't come on your face and clog your pores. Typically when you get a lot of massages, a lot of people get massages during pregnancy. So avoid using too many oils around your face or on your back or wherever if you have acne in those areas. Have a lot of fiber, have a lot of protein, and stay very active, again, within your physical limits, what has been told to you by your doctors, but stay active. Don't just, completely become sedentary because you're pregnant. If you are allowed to medically, absolutely stay active. That would help also with your skin and hair. Next, coming to a very common question. I have no concern. My skin is doing fine, but I want to have a skincare routine to take care of my skin during my pregnancy. So what do? I'll give you a couple of pointers here. Start with a mild face wash suited to your skin type, whether it's oily, whether it's dry. So just choose a face wash according to your skin type. Use a hyaluronic acid for hydration. If your skin feels dehydrated, use a hyaluronic on damp skin. In the morning, top that up with a vitamin C or a niacinamide. Avoid vitamin C if you're acne prone though. Over that, apply your moisturizer and then your sunscreen. Reapply your sunscreen in the afternoon. Just make sure your sunscreen, as I said before, is mineral based or a physical sunscreen. You can also use tinted mineral based sunscreens. That's not a problem, but stick to mineral based. At night, you can use your face wash again. Again, you can do a hyaluronic for hydration, or you can directly use peptides, which will help with an anti-aging role, and they're again completely pregnancy safe. So you can use a peptide serum or a cream, layer that up with a moisturizer again. So that's a basic skincare routine for all of you who are pregnant and want to take care of your skin during this time. You can also use ingredients like glycolic acid or kojic acid at night, which would help you with depigmentation if that's a concern that you're facing, which a lot of people face during pregnancy. Next, coming to skincare procedures that you want to undertake during your pregnancy. Again, there are a lot of procedures that are completely pregnancy and lactation safe. So we stick to milder medifacials, hydrating medifacials, which will help your skin with the hydration part of it, and avoid lasers within those medifacials as well. You can do certain chemical peels, not all of them, certain chemical peels. So definitely get them done from a certified dermatologist who knows what they're doing and who knows that, this is pregnancy safe or it's not pregnancy safe. You can do microneedling. There's a lot of procedures, minor procedures that you absolutely can do during this period. Do not do lasers during pregnancy, but they are safe during lactation. But during pregnancy, honestly, it's a theoretical risk. No one really knows for sure whether it's safe or not. But no one wants to study this. No one's going to, get a bunch of pregnant women, do lasers on them, and then check whether anything happens to their babies. Nobody's going to take that chance. So there are no studies available about the safety of lasers during pregnancy. And there probably never will be, because no one's going to bother trying to find out. We just don't want to take that risk. Lastly, coming to your hair. Now, usually during your pregnancy, your hair is beautiful. Because of the hormones, you go into prolonged anagen phase, that is a prolonged growth phase. So your hair becomes lustrous and thick and gorgeous. But the moment you're done, once you deliver, within 2-3 months, you will undergo massive hair shedding. It's known to happen. It's called a postpartum telogen effluvium. It will happen. You may lose clumps of hair, but in saying that, it lasts about a year. So don't worry too much about it. Don't fret that, I'm going to lose all of my hair. I literally get patients who bring their hair to me. They collect their hair and they bring it to me. They tell me, doctor, this is how much I've lost. But it's going to come back. Don't stress, okay? Even if you lose a lot, all of it grows back. It's just the hair cycle that's happening. This is the same phenomenon that used to happen post-COVID, post any major surgery, post sudden weight loss. It's called a telogen effluvium, and it does normalize. But what can you do to reduce the duration of this hair fall is eat really well. Try to sleep well. I know it's really hard with a newborn to sleep well, but try to sleep well. Try to get some whatever minimal amounts of exercise in. Have a lot of protein in your diet. Drink a lot of water. Other than this, start on a peptide hair serum for your scalp. Your dermatologist would be able to help you out with that. Stick to a peptide-based hair serum for the scalp, for the crown area of your scalp. So 4 to 5 sprays over the entire crown area and massage it in. That is what makes a huge difference. Also, a multivitamin supplement. If your gynac has already given you a multivitamin supplement, absolutely great. But if not, ask your dermat or your gynac to help you out with a supplement. Very often there's deficiencies, you're producing milk, and there may not be enough of these supplements for your body, these micronutrients for your body, because of which you may have to take a supplement, which you can absolutely take, and it'll definitely help you with your hair fall. Also, when we talk of hair coloring and hair treatments during pregnancy, I would definitely not recommend doing hair colors and any chemical treatments on your hair involving straightening, because these are chemicals that could definitely be toxic for your child. You can, however, definitely go in for hair spas, hair medi spas, which will help you feel relaxed. In hair medi spas, we also do a scalp stimulation. So it also really helps with boosting circulation to your scalp and reducing hair fall during this period. So these are things that you can do. And I really hope this video helps at least one woman who is currently struggling with skincare or hair care during her pregnancy or her lactation, which is such a beautiful, beautiful phase of her life. And I do not want anyone to struggle during this phase. If you have any questions about your skin or hair care during pregnancy or lactation, do ask me in the comments and I will be happy to help you. Also, please do remember to subscribe to our page. It would be very helpful and it would keep us motivated to keep making more such content for you.